there questions that patients should ask about their proposed treatment plan?
Yeah, I think patients should ask a lot of questions. I think a lot of patients don't ask as many questions as they should, but I think that there are a number of things that are important for patients to know. I think number one, the question is whether they need treatment at all, and what happens if they defer treatment. So really, and that's another way of asking what the goal of treatment is going to be. I think patients should have an expectation of what their physician thinks the benefit of starting a particular treatment might be. I think that they should ask questions about the drugs that they're taking. Are they new drugs? Are they well established? What are the side effects? And I think the side effects fall into a number of different categories. Some of the side effects are immediate side effects that patients have and notice soon after they start taking the drugs. Some of the side effects can be much more subtle. And we know, for example, that some of the agents that are used to treat myeloproliferative neoplasms can suppress the immune system and can make patients more susceptible to infection. And especially today with lots of infections out there, it's important for patients to know whether this is something that they should be particularly attuned to. I think that patients should also find out whether there are any lifestyle inhibitions. So sometimes how many times you take a drug, whether the drug has to be taken on an empty stomach or with food. Those sorts of things I think can be really important in deciding whether this is a treatment that's right for the individual patient.
Yeah. Dr. Heaney, how would you define treatment goals, and why is it important that patients understand the goals of their treatment plan?
Yeah, often patients do start treatment without a clear understanding of what the goals are. And I think sometimes the goals that physicians have may be different than the ideal goals of the patient. I think we're really fortunate in myelofibrosis today that we now know that ruxolitinib is something that prolongs survival, and we have a drug that has that ability. And I think articulating that as a goal to patients is important in their understanding of why a physician might want to push through some toxicities and say, I know that this may be causing some GI upset, but we're doing this because we think this is something that may help you to live longer. Mm-hmm. So I think that's part of, and that may be the physician's main goal. That may not necessarily be the patient's main goal, and the patient's main goal may be quality of life. And so it goes back to the question about dialogue and understanding what the patient really wants out of his or her treatment, and making sure that the patient and the physicians are talking to each other, not past each other.